I have ADHD. That's a sentence I so often hear without the person having the diagnosis. In most cases, I found out that it's because they have seen a TikTok or YouTube shorts saying, if you breathe, you have ADHD or something like that. So I say to you, my fellow nurses and nursing students, this is the video where I tell you why you most likely just have the diagnosis of being a human. But first, a little disclaimer. For legal reasons, I have to say this. This is for entertainment and educational purposes. If you have any concerns about your physical or mental health, talk to your own doctor about it. And let's dive into what ADHD is and why you are likely not to have it. I completely understand, as someone deeply engaged in the medical field, how these terms can be thrown around casually without the proper understanding of the gravity they carry. ADHD, attention deficit hyperactive disorder, is a legitimate neurodevelopmental disorder that affects individuals in a significant way. ADHD is characterized by persistent patterns of inattention, hyperactivity, and impulsivity that can interfere with daily functioning and quality of life. It's a complex condition that requires a thorough evaluation by a qualified healthcare professional for an accurate diagnosis. As a nurse and nursing student, it is crucial that we differentiate between casually using medical terms and truly understanding the medical condition behind them. Putting in a connection between common distractions or occasional bouts of inattention with ADHD undermines the experience of the individual generally dealing with this disorder. So in this video, I aim to shed light on what ADHD truly entails, dispelling misconceptions and encouraging a deeper understanding. Remember, it is always essential to consult a healthcare professional if you have concerns about your health. Now let's delve into the intricacies of ADHD and why it is essential to approach this topic with care and knowledge. Attention deficit hyperactive disorder is a neurological development disorder that primarily affects children, but it can persist into adulthood for some individuals. It is characterized by persistent patterns of inattention and or hyperactivity, impulsivity that can impact various aspects of life, including work, education, relationships, and overall functioning. It is a legitimate handicap, and at least in Denmark, where I am at, it is looked upon as such. But handicaps, well, they hit individually, and some people can still go to work, while others, they do not function in society. So let's delve a little more into ADHD. Because inattention in ADHD often manifests as difficulty sustaining attention on task, frequently shifting from one uncompleted activity to another. It is also forgetfulness in daily activities and becoming easily distracted by unrelated stimuli. Hyperactivity and impulsivity manifest as an inability to sit still, excessively fidgeting, restlessness, difficulty engaging in leisure activity quietly, impulsive decision-making, and trouble waiting for others' turns. And as a nurse working in mental health, I often see patients with ADHD. And one of these waiting for others' turns, one of the ways it really manifests itself is when we play games, because they just want to get their turn over. Well, I move my piece, they move their piece. When I am going to pick up the dice, roll the dice, as soon as the dice hits the table, many of them will try to grab the dice, or at least their impulsivity wants them to. If they are either well medicated or in well control of their ADHD, some of them don't need medication to get control of this ADHD. There are several treatment ways. That's not for now, but basically, unless they have control over this disorder, they will grab the dice and they will roll the dice before I'm finished with my turn. So it is one of the ways where I truly see it in my patients. There are many other ways, but this was just a short example. But let's go on. It's important to emphasize that individuals with ADHD don't just experience these symptoms from time to time, they consistently struggle with them in different settings, such as work, school, or at home. These challenges can significantly impact their quality of life and performance in various domains. The cause of ADHD is complex and multifaceted, likely involving a combination of genetics, neurological, and environmental factors. While ADHD is commonly diagnosed in childhood, it is now recognized that it persists into adulthood, and many adults remain undiagnosed. In the following segment, we will explore the diagnostic criteria for ADHD. Diagnosing ADHD is a thorough and comprehensive process that involves multiple steps and assessments. It is important to note that a single quick evaluation isn't sufficient to diagnose ADHD accurately. Healthcare professionals, including psychiatrists, psychologists, pediatricians, and sometimes nurses, follow established guidelines to reach a reliable diagnosis. The first step is clinical assessment and history taking. The process usually begins with a comprehensive evaluation of the individual's medical history, including any potential signs of ADHD during childhood. Information is gathered from patients, guardians, teachers, or significant others to obtain a well-rounded understanding of the individual's behavior and functioning in various settings. Secondly, diagnosis criteria. The diagnosis of ADHD is based on specific criteria outlined in the Diagnostic and Statistical Manual of Mental Health Disorder, DSM-5, or in the Identification and Classifications of Diseases, ICD-10. These criteria include symptoms of inattention, hyperactivity, and impulsivity. These are needed to be present for a certain duration and in multiple settings. Thirdly is behavioral observations. Direct observations of the individual's behavior, often using standardized rating scales, are essential to confirm the presence and severity of ADHD symptoms. Fourth, medical and neurological examination. A thorough physical examination is conducted to rule out any underlying medical conditions or neurological issues that could be cause of the symptoms. Various medical tests may be conducted to ensure that no other health conditions affect the individual. And the fifth aspect, psychological testing. Psychometric tests and assessments may be employed to measure specific cognitive functions and assess the severity of ADHD symptoms. And the sixth aspect is ruling out other conditions. It is crucial to rule out other mental health disorders that can be present with similar symptoms like anxiety, depression, or learning disabilities. The seventh aspect, yes, there are many aspects, but the seventh one is consistency of symptoms. To make the diagnosis, the symptoms of ADHD must be consistent, pervasive, and not solely related to specific situations or events. The diagnosis process aims to ensure a thorough understanding of the individual's functioning, ruling out other possible explanations for the observed behavior, and determining if the symptoms aligns with the criteria for ADHD. Once a diagnosis is made, a comprehensive treatment plan can be developed, which may include a combination of behavioral interventions, counselling, education, and sometimes even medication. And in the upcoming session, we will delve into the treatment options for ADHD and how healthcare professionals can play a vital role in supporting individuals with this condition. Understanding the diagnosis process equips us to offer better guidance and care for those affected by ADHD. But for now, let's discuss the various treatment options for ADHD. First up is behavioral interventions. Behavioral therapy are often a fundamental part of ADHD treatment. These interventions focus on developing specific skills and behaviors to manage and cope with the symptoms of ADHD. Behavioral techniques can include behavioral modification strategies, social skill training, organizational skills training, and classroom or work accommodations. And the second tool in the toolbox for helping people with ADHD is counselling and psychotherapy. Individual or family counselling can be incredibly beneficial for individuals with ADHD, and cognitive behavioral therapy, CBT, is commonly used to address emotional and behavioral challenges, improving self-esteem and enhance problem-solving skills. The third tool, and it is here we nurses often can be a big part of it, is educational and psychoeducation. Providing education about ADHD, its symptoms and management strategies is crucial for individuals with ADHD and their families. Understanding the condition can reduce stigma, enhance coping mechanisms, and improve overall quality of life. The fourth tool in the toolbox is medication management. Medications may be prescribed based on the severity of symptoms and the individual's age. Common medication for ADHD include stimulants and non-stimulants. Stimulants can be something like amphetamines and methylphenidates. I believe it's pronounced that way in English. Don't slaughter me in the comment if it's pronounced another way. I go mostly by Danish names when I try to pronounce this long a word in my daily practice. But you might say, oh, amphetamines, that's an illegal substance, not a medication. But what about non-stimulants? What kind of medication is that? It is products like atomoxetine and guanfacine. But no matter what the medical treatment, it is important that you have continuous talks with your doctor about these medical treatments, because if there are any side effects or any unpleasantries, you need to talk to your doctor about it. Or if you have any apprehensions about it, if you have any questions, it's important that you direct it to healthcare professionals in your environment, because, well, this is only a YouTube video. I can only give you my experience and what the guidebook says. But what benefit does this medication gives? Well, stimulant medications often improves attention and focus by affecting neurotransmitters in the brain. And non-stimulant medication also influence brain chemistry, but in a different way. And if you want me to go more in depth with how medication work, then write it down in the comments. I will make it if you want it. And now we come to my favorite part, the part where I am a master of the trade. It is diet and lifestyle adjustment. It is where the nurse can shine. As nurses, we can encourage a healthy diet rich in essential nutrients and maintaining a regular sleep schedule, and it can help manage ADHD symptoms. Regular physical exercises and structured routines can also be beneficial in managing energy levels and improving overall focus. Another thing I as a nurse have a lot of experience with is support groups, and it is the sixth tool in our toolbox. Joining support groups can provide a sense of community and understanding. Interacting with others facing similar challenges can often, emotionally support each other and give each other practical help. And that will really help a person with ADHD to blossom up and flourish in our society. And as nurses, our job is to facilitate this contact. And it might be to facilitate a good contact in the group. It might also be just to facilitate a contact with the group. And the seventh tool is what doesn't fit into anything else. It is complementary and alternative therapies. Some individuals find relief through complementary therapies such as yoga, mindfulness, and acupuncture, or biofeedback. While these may not be the primary treatment, they can be used as an adjunction to the traditional approach. And I have seen many patients try out with different alternative methods. I have seen them try fully on alternative methods. It rarely works. For some it works. I will not say it doesn't work at all, but I rarely see it work. But use them as a supplement to the traditional treatment. Well, that is where I see many of my patients flourish. So if you are in doubt about diving into such a thing, well, you need to speak to your doctor about it. The most efficient approach to ADHD management often involves a combination of these strategies tailored to the individual's needs and circumstances. It is important to regularly monitor the effectiveness of those chosen treatments, the plans, and make adjustments as needed. And that is also why you need to have a good relationship with your healthcare provider. As a healthcare professional, understanding these treatment options and their potential benefits empowers us to guide individuals with ADHD towards the most suitable and effective approach for their unique situation. In the subsequent segment, we'll discuss how healthcare professionals, especially nurses, can offer valuable support and care to individuals with ADHD. Remember, a comprehensive treatment plan and supportive environment plays a crucial role in managing ADHD and improving the quality of life for those afflicted by it. Now let's explore how we as nurses can provide support to individuals with ADHD in both hospital and daily life settings. In a somatic and psychiatric hospitals, it is important that we focus on the following. Comprehensive assessment. Of course, we need to begin with a thorough assessment of the patient's medical history, ADHD diagnosis, current symptoms, and any coexistence conditions. Collaborate with the psychiatric team to understand the specific treatment plans and any prescribed medications. We also need to maintain an open and clear communication with the patient, addressing any concerns or questions they may have about their condition and treatment. We need to explain procedures, the effects of medications, and expected outcomes to alleviate anxiety and uncertainty. We also need to establish a structured daily routine for the patient within the hospital settings. Consistency can help manage anxiety and provide a sense of predictability. And in the hospital setting, administering medication according to the prescribed schedule, ensuring correct dosage and monitoring any side effects. This might be important, but it is just as important that we give the medication on the same time each day. If they're used to getting their medication at 8 p.m., then we give it at 8 p.m., not at 9 p.m. And we also need to utilize behavioral interventions to assist the patient in managing their symptoms efficiently while in the hospital, offer coping strategies and techniques for dealing with impulsive behavior and improving attention and focus. And this one goes out to all my somatic colleagues. Collaborate with the mental health professionals. Work closely with psychiatrists, psychologists, and especially the psychiatric nurses in making sure that you have an environment fit for a person with ADHD and make sure that you can give them the full benefit of, well, a great treatment, even though they might have some other needs than your usual patients. But let's move on to the daily life at home. If you have nurses support while at home, it is important that the nurse is there for educational support, providing educational and resources and information to the patient and their family about ADHD, its management, and available support services. Offer guidance on creating a supportive environment at home, tailored to the individual patient's needs. We also need to help with routines and organization. Encourage the patient to establish a daily routine at home, including scheduled meals, regular exercise, and dedicated study and work time. Offer organizational tips to manage their belongings and tasks efficiently. And if you want some tips on how to manage your own life and how to get it a little easier, then write it down in the comments, because I have a lot of tips I have learned from when I was studying to become a nurse. I had a full-time job, I had my nurse's education, and I had a YouTube channel also back then. So I had plenty to do, and I still managed to do it all without getting stressed. So I'm a master of organization, and you can comment down below, and I will make an episode if enough people comment on, we want to see the organization, how can we do it better. But let's move on, because there is also medication adherence. This is a thing we as nurses need to support the patient in. It is very important that we support the patient's compliance. Usually when an ADHD patient becomes non-compliant in medication, it is not because they don't want the medication, it is often because they get distracted. It's often because they forget it. It is rarely because they don't want the medication. So make sure that we give the opportunities for the patient to take their medication. And if you want another episode about support system to take the medication for better coherence or compliance, I like to use coherence because they have to see the entire thing as not just the medication, it is the entire situation that can become better with coherence. I'll make an episode about coherence. But if you want a lot of tips and tricks on how to help organize a patient's medication and how to make them remember their medication, you know what to do. But let's move on. Of course, we as nurses can also help with behavioral strategies, suggest and reinforce behavioral strategies such as using timers, creating to-do lists, and break down tasks into manageable steps, offer guidance on mindfulness and relaxation techniques to manage stress and anxiety. That is the things we as nurses can do. And of course, we also have to encourage the involvement of family, because it is not just the patient, it is the entire family that suffers from one person having ADHD, or they're at least affected by it. And then we have to assist the patient in getting, to the community resources, the support there are in the local community. It can be patient organizations. It's a bit different from place to place, but no matter what things you offer in your local community, make sure you guide the patient in that direction. And as a nurse with a passion for my patients, incorporating a holistic and compassionate approach to support individuals with ADHD is crucial. By collaborating with the healthcare team, utilizing effective communication and providing personalized care, nurses can significantly contribute to improving the lives of people who are afflicted by ADHD. And if you want to get smarter on the holistic approach, then check out this video right here about Kari Martinson's theory. I promise you it is a great holistic theory, so check it out right here.